Hello and welcome to Health Matters on Channels TV once again. Thanks for joining us. I am Mary Alale Yusuf. Family planning, which is the method of planning when to have children or child spacing, is closely linked to contraception or birth control. According to World Health Organization statistics, about 222 million women who would like to put off or totally stop having children are not using any method of contraception. Family planning can reduce the need for unsafe abortions and incidence of certain diseases. On the show with me today is Dr. Ayodeji Olamijulo. He is a consultant obstetrician and gynecologist at the Lagos University Teaching Hospital, a fellow of West African College of Surgeons, National Postgraduate Medical College of Nigeria, and Royal College of Obstetricians and Gynecologists, London. He is also a diplomate of the Faculty of Family Planning in London. You're welcome to the show, Doctor.
Thank you.
That is a long list of achievements you have there.
Thank you.
Would you tell us what are the benefits of family planning?
The benefits are quite immense to the nation, to families, and to individuals. Now, since this is a health, matters program, the immediate impact to the family on their health. Family planning or birth control has been linked with improvement in maternal health, positively impacting on maternal morbidity and mortality. It also impacts positively on child health, again reducing perinatal mortality and also reducing deaths in infancy. Now, from the point of view of the, of course, there are social benefits, economic benefits to the family and to the nation as well. We know that, resources are limited, and when it has to be shared amongst people, the increasing number of people, then you know that.
So here we are talking about population.
Exactly.
The less the population, the more goes round.
Exactly.
But let's talk about how it is beneficial to the mothers. How exactly does it impact on the health of the mothers?
Well, like you said, we know that high parity, for instance, is associated with increased maternal mortality. And it's also the case that family planning can help to prevent pregnancies that are considered to be high-risk pregnancies. Either pregnancies too early, that is in women who are too young, or in women who are too old, or pregnancies that are too close together, or pregnancies in certain women with certain pre-pregnancy conditions that it would be better.
If pregnancies are too close together, what really is likely to be, what problem is likely to crop up?
In simple terms, the mother has, a shorter time to recuperate from the previous pregnancies, and there is depletion of the, nutrients. You have increased risk of anemia, and so on and so forth. And of course, the mother needs to recover psychologically as well and physically to be able to withstand, subsequent pregnancies. So having pregnancies too close together, can be dangerous.
And how about the children? How does this impact on health of children? How does contraception and family planning impact on the health of the children?
Well, first is, where we started from, the family has more resources to look after the individual child. But it's also true that the mother, for instance, will have more time to attend to the baby's nutrition in terms of breastfeeding, or even when, other things are added, the mother has the time to look after the child. Has time for things like, immunization, and so on and so forth. So, the statistics is there, it's stark. It shows that women with lower family size, the children, do better in terms of survival and in terms of being in good health.
What would be the reason for 222 million women who actually would like to space their families? What would be the reason for them not going ahead to put into action what they have in their heart?
Well, the reasons are diverse. One, it's not everybody that is in the know. In other words, not everybody is aware. There's been some improvement in awareness about contraception recently, but it's still the case that a lot of people don't know much about family planning, and knowing adequately, the benefits, and there are a lot of myths also that surround the use of, family planning products. Some of these myths people need to clarify. Okay. They're not aware of it, and they need to know. But perhaps the other big issue is the issue of access. Not everybody who wants to use family planning has access. Access could be physical, it also could be in terms of cost. Even if you know where you can get the family planning products, if you cannot afford it. And by the way, you know that there's poverty in the land, and a lot of our population still live under the poverty line. So cost is a big issue in limiting access. There are other barriers, socio-cultural barriers, religious barriers, and so on and so forth.
But I think coming to cost, wouldn't it be more expensive in the long run to have a baby you didn't want than to prevent? I mean, you're going to take care of this child for years to come, so wouldn't it be more expensive then?
Yeah, you are right. It on the long run or the long term, it's more expensive to have a baby you don't want, and it's more dangerous as well. But when you are acting prospectively, some of these issues, you can really not conceptualize, and you just act within your immediate capability. So, and that's, because for many of the women, it's like they don't have a choice in the matter.